I will be demonstrating how to insert mono threads. I will be using the Mint mono threads, which is a collagen booster. So it's not a lifting thread, it's really to boost collagen. And my patient today specifically wanted to lift the jowl area, where we could obviously use lifting threads, but I also want to ensure that we really boost the collagen in her skin around the marionette fold, the jowling area, also to prevent small little wrinkles. So we start the procedure with cleansing the area carefully. I'm using a chlorhexidine and alcohol solution to really ensure that we've got proper disinfection, and informing your patient not to touch the area while you're working, because the PDO thread will remain in there for quite a few months, and we don't want to introduce any bacteria. The secret with mono threads is that if you put too little, you won't get a good result. So really it needs to be very superficial, as close as possible to the dermis, and as much as possible that you can actually insert. Insertion is not in the SMAS level as we do with the lifting threads. It really is a very superficial level that you work on to stimulate really the dermis. Very superficial. So this is the mono threads, the easiest to start off with if you're not familiar with it. It is a sharp end needle, so you need to go very soft and carefully, and also make sure that your patient understands that they could have bruising. Okay, so you can insert and remove, but sometimes it's just very nice to leave it in so that you know exactly where is the previous one. So look at my spacing, very close together, because putting one every centimeter is really hoping for a miracle of collagen stimulation. You want to really form a grid underneath the skin to get a good result. So I used on this patient a topical anesthetic cream before. She's had it on for about 40 minutes, giving quite a bit of anesthesia. Okay, so very superficial placement and very delicate soft placement to make sure that you don't cause too much bruising. Obviously, the thinner the skin is and the older the patient, the higher the risk of bruising. And there's no specific vector or pattern. It's really just strengthening the whole area that you want to lift. With her, the concern is the marionette fold. So that is why I'm starting already from here and then actually go towards the marionette fold. What is nice is to leave the previous threads in, because it actually helps you to put the next layer even more superficial, as you're actually quite forced to work above it, knowing that you will be quite superficial. And it's quite interesting, there's quite a few videos and procedures that shows putting even like 100 per side on the face, and it sounds like it's just done for social media, but in actual fact it's really going to give much better results. We tend to really underutilize the amount of mono threads and then complain and say that we're not getting results on our patients because you're only putting 10 per side. So if you're going to use 10 per side, make sure that it's a small area that you're treating. Okay, so really focus on being superficial. And you'll see now I'm going above the others, forcing these ones to be even more superficial, which is really perfect. And this is a good combination with a lifting thread underneath, which is obviously placed in the SMAS layer. So removing it, you first push it in again and then just remove. Just to ensure, and you can give it a little bit of a turn also just to make sure it remains there. Pushing in again, turning, removing. push, turn, remove. Minimal bruising in this patient, but as I said, an older patient or very thin skin, much higher risk of some bruising that will take anything from 5 to 10 days to resolve, but not any other problems on the skin, and the bruising can be covered with some makeup for the week or two.